Welcome to Conversations in Social Care, a unique and refreshing podcast for the social care sector, brought to you from Care Talk.
Hello and welcome to this Care Talk Business podcast. My name's Karen Rogers, owner and director of the Herefordshire Care Homes Group. My guest today is Sarah McClinton, the current president of ADASS. Sarah has a long career in local government, having also worked in Whitehall, and is now Director of Health and Adult Services at the Royal Borough of Greenwich. In this podcast, Sarah talks about the crisis in social care and whether the reforms set out in recent white papers will solve this crisis. Welcome, Sarah.
So can you talk us through your journey into social care and what has inspired you to join the sector?
Yeah, so I suppose, I grew up in South London in a very diverse inner city community, and I guess I was always kind of driven by the obvious inequality and a desire really for social justice was something that fired me up very early as a teenager. And I then went off to university and started working with young offenders, so people who, teenagers really, who'd got to a point in their lives where their lives could go in many different directions. And I suppose that's what got me into social work. And I did various roles and trained as a social worker. I did work with children and families as well as with adults. But I guess one of my very early roles which was quite shaping, was working with people with HIV. In West London when the the AIDS epidemic first hit, and services weren't really set up to respond to the needs of those people. So I guess I had the opportunity quite early in my career to work in a way that was developing very personalised services that were much more tailored around individual needs and responses, because I think we were working with a group of people who the services were we had, for example, this is a long time ago, admittedly, home helps who refused to go in and work with people with AIDS. But also I think people were not accepting that the kind of traditional menu of services that was then on offer. So I guess very early on, I was working in a way that was stimulating innovation. A lot of it was around peer support networks and developing those sorts of self-help services, but also very, as I say, personalised responses to people. And then I suppose I, did a variety of roles within local authorities, and I've worked for a number of local authorities, mostly in London. And most recently as the director in Greenwich, as you say. But I suppose those were the things that kind of really inspired me, the opportunity to do things differently and to work with people rather than doing things to people.
Thank you. It's interesting actually going back to those days of home help, which I remember very well. And I also remember the fear that people had of working and supporting people who were living with AIDS and HIV. So it's interesting. And that, to some extent, was a bit of the change, wasn't it, with the introduction of the NHS and Community Care Act and the change from home help to home care. So, those were interesting times. So that's great. So as president of ADASS, what are your own personal values? And how do you ensure that that's cascaded and embedded through to members?
So I've always worked in public service, and I think fundamentally my values are public sector values, and they're also, as I say, I trained as a social worker, and they're reflected in social work values. So I think for me that's about fairness and equity, and trying to achieve social justice, but also about valuing people as individuals and supporting people to reach their potential. And as part of that, clearly respect and dignity and supporting people to, promote their rights, I think are fundamental. And as I said, kind of working with people, not doing to people. So, because often I think individuals and communities can find their own solutions, and our role is really to support them to do that. focusing on what's really important to them. So I suppose, those are my values. And I think that, ADASS as a charity obviously aims to make sure that people are unable to access the care and support and safeguards that they need. So in a way, I don't see it as cascading those values, because I think as an organisation we sort of embody those values that are throughout social work and social care broadly, and those public services values. And I think directors across the country, so we represent 152 local authorities, and my experience of directors is the kinds of motivations that people have to do the roles means that those values are fairly embedded, entrenched, and collectively held actually by the organisation, but also by our members.
Great, thank you. So we've heard a lot about fixing social care, and I think there's a bit of a suggestion that we've got social care fixed now, which we're hearing a lot about today. But what do you think has actually led to this crisis in social care?
Well, I think the first thing to say is that social care clearly is not fixed. And as you say, I think there's a risk that there's a growing sort of narrative that it is. And I think that there are really significant issues that we face. So in terms of what's led to it, I think it's fair to say that successive governments failed to tackle reform of adult social care, and we saw various attempts at that. So as ADASS, we do welcome the fact that the government are now pushing forward in terms of some reform, but I think it's fair to say that most of that is focused on that kind of grasping the nettle, if you like, in terms of who pays for care and the balance between the citizen and the state. But there are really significant, I think, underlying issues which we do need to tackle. In terms of causes, I think we've seen more than a decade of significant underfunding. We know that the funding to local authorities reduced in real terms. We didn't see the growth, for example, that the NHS benefited from, and we're facing similar pressures in terms of demographic needs, and people will be well aware of those kind of demands on services. So I think that it's really clear that the problems that we face predate COVID, and they've been building in the system undoubtedly, and then they've been exacerbated, I think, by the pandemic, and we're seeing those pressures increasing, and a quite alarming trend really in terms of the numbers of people that we see in social care who are waiting for care and support. We're providing more support than we've ever done before, but worryingly also seeing that we're not able to provide all of the support that people need, and to keep pace really with that level of pressures within the system. So yeah, I think some long-standing issues which are contributing and creating very pressing needs at the moment.
Thank you. Well, I think we're in a really challenging time right now. We're in a position where we're supposedly recovering from 2.5 years of the pandemic, austerity, and at the same time, we've got a huge reform of adult social care with a number of white papers. So what difference do you think this will actually make? And do you think it will solve the crisis?
So in terms of the reform agenda, I don't think it's going to solve the crisis, no. And as I said, I don't think it's going to fix social care. We do, as ADASS, as I said, welcome the fact that there is some movement in terms of tackling some of those issues around the balance of who pays. But I think what we're seeing from our members is increasing evidence of more and more unmet need, undermet need, and wrongly met need. So I think that there's a lot more that needs to happen really in terms of a properly funded plan, which which can tackle some of those current pressures, which I've just talked about, because actually what we're seeing is those are getting worse at the moment at quite an alarming rate. And I think fundamentally we need more investment. So we would like to see more of the health and care levy coming to social care, and that coming sooner. I think one of the things that is needed is a recognition of parity of esteem, essentially, across health and care, and a shift in the way people think about the system as a whole.
Yeah, and I think within all of that, there's do you think there's a risk that we're looking at white papers in the context of funding care, and maybe we should think a bit more about the kind of care that we actually want, the kind of care that people who draw on care and support are saying that they want to receive and that we think they should receive?
I think that's absolutely right. I think we need to see more in terms of if we think about the think local, act personal framework in terms of the I statements and we statements. I think what we need to see is how do we make that a reality? What does that mean in terms of developing more housing options for people? I think by 2050 there'll be 1 in 4 of us will be over the age of 65, and that's got, that might be relatively young these days, 65, but actually it is a time when you need to begin to think about and plan for the future, and having those options that enable people to stay in their own homes and to receive or be able to access that personalised care and support, I think is really important. And it sort of feels like things have developed in quite a haphazard way. So, we see lots of social care staff, for example, who, really ably and competently are carrying out more and more health tasks than the things that historically might have been done by the NHS. But actually, what we need is a more of a planned approach to how are we going to use all of our resources across the system, and how are we going to make sure that those services for people who draw on care and support are there in a way that enables people to live their lives actually in a positive way.
Thank you. Enactment of Section 18.3 is obviously part of the reform. So what are your views on that, and do you think that will create a fairer system?
So I think through various announcements, we've seen lots of elements of reform, and it feels a bit like they're kind of single pieces of a jigsaw, which go some way to tackling some of the issues. But as I said, they don't really kind of tackle the current and pressing needs. So at the moment, we've got over 500,000 people waiting for social care, be that assessments or reviews, or actually waiting for support to be put in place. We, as councils, there's more and more support at home being provided. I think that went up by 16% in the last year. But as I said, worryingly, that increasingly that's begun to stall, because we can't. There isn't the capacity to continue to increase the amount of care that can be provided at home. So, and I think that's compounded. There's underlying issues which perhaps we'll come on to talk about workforce and recruitment and retention, and how do we really tackle those issues, I think are critical and fundamental to some of the things that need to change. I think in terms of 18.3, given, as I said, there are already 500,000 people waiting for care, it's great, to think about what is a fair cost of care, what actually does it cost to provide high quality and that personalised support for people who draw on care and support. But we've already got people in the system who are waiting, and I there's a lot of concern really about how we're going to, on top of that, deal with people who are currently self-funding, making their own arrangements, coming to local authorities, and how all of that is going to work, and also whether the funding in the system will actually cover what's required.
Do you think there were definitely conversations about risk to the sector, risk to the care home sector, in terms of people providing care, particularly the self-funder market? So there's a concern that this actually won't address cross subsidies, that people will obviously still choose the service that they wish to go to. They may then pay the hotel charges, which more or less brings us back to the position we're in currently, where people have a sort of a cost of care and then they pay a third party contribution. So I just wonder whether that's been modelled sufficiently, and whether we think we will still have this significant cross subsidy within the adult social care sector.
Well, as I think, as I say, I think there is definitely concern about that. If we look at the work that the County Councils Network, for example, did with Newton, what that showed was there's a really significant gap between the modelling that was done by the Department of Health and Social Care and what actually the reality might be. So obviously we're currently embarking on that exercise, but I think we'll have to see what the outcome of that is. But I think that there are some fundamental worries really in terms of how that will work.
Thank you. You've already referred to the number of people who are waiting for care and support. What more do you think the government can do to address this? It's challenging, isn't it? It's challenging, the challenges of recruitment, and but what can we realistically do?
So I think what the government needs to do is work together with professionals in the sector and build a plan that is ambitious, really, about that both addresses those current pressures and issues, but also tackle some of those structural problems, be that workforce or capital investment, for example, in more housing and technology solutions. So I think in terms of if we think about workforce, having a proper workforce plan would be really important, that sets out kind of what are the skills and the different roles that we might need in the future, and how we're going to make sure that there is that people who work in social care are truly valued, and that comes that's both how we all remember the clapping for carers, don't we? And it started off very much as an NHS focus, and often social care is a bit of an afterthought. So there's something about public awareness and that real valuing of the work that people who are doing brilliant work in social care carry out. But that all has to also be reflected, I think, in proper remuneration, so pay and terms and conditions. So if we want to recruit and retain people, particularly in the current climate, where we're seeing lots of competition from other industries, then and also increasing cost of living, so some real pressures there, and potentially a sort of perfect storm. But we know that from the data that Skills for Care produced, that the vacancy levels in social care are increasing, that over 1 in 10 jobs are currently vacant, and if you look at support in home care, that's over 13%. So I think there's something fundamental about pay and those terms and conditions. So how do we create a workforce where people are not on 0 hours contracts, where people are able to contribute and be valued as part of our local care networks, and as ADASS we've called for a sort of minimum care wage that would address some of those issues. So I think that's really one of the fundamental things, and then I think what we're seeing, and again from our surveys, what we're seeing is carers are increasingly having to step in and fill gaps. So I think more attention to support for carers is really important. And then I think we have a national conversation which is often dominated by what's happening in the acutes and part of the NHS. And I think that what we need to do is shift that to focus on the whole system and think about how we build up community capacity, be that community services, mental health services, primary care and social care together. So I don't think the NHS is going to be fixed unless we do properly fix social care.
Yeah, thank you, Sarah. I mean, it's incredible the skill that's in social care and
Absolutely.
skill that's required to work in social care, how to keep people well. And, you know, we have a lot of incredibly skilled staff that reverse frailty, avoid hospital admissions. And how do we recognise that and set people on a really good career pathway? So, yeah, you know, I completely agree with all of those points. Great, thank you very much. So the increase in living costs and energy costs and fuel prices are really having an impact on our frontline care workers. So I just wonder, do you think there's anything else we can all do, government can do to support people so we can attract more people and actually make it worthwhile for people to carry out that role?
Yeah, I mean, I think what we're seeing in terms of increases in fuel, energy, food costs. I mean, I think it's important just to recognise that that doesn't just affect our workforce. That's a big issue, and I'll come back to that. But actually, people who draw on care and support, often older and disabled people are amongst the lowest income households. So I think that in councils, we see the impact of that, and there's increasing needs for support, potentially, or not potentially. There's definitely increasing needs as a result of that. We're also, councils also facing some of those inflationary pressures, and what does that mean? And of course, providers across social care are experiencing those things. But I think there's a real concern at the moment, given what we've already kind of talked about, really, in terms of the state of the workforce in social care and some of those real challenges that we've got. We also know that 90% of home care workers use their own cars for work, and we're increasingly hearing stories of people saying they just can't afford to work in the sector anymore. So that increasing level of vacancies, I think, is really the risk is that is growing pace as well, in terms of the situation is definitely getting worse rather than better. And when we think about, given what I've already said about pay and terms and conditions, people working in social care are often least able to afford, fuel efficient vehicles. I work in London, and we have the ULEZ, the low emission zone, which disproportionately then affects people who've got older cars, who as a result of lower incomes, etc. And that's been a big issue for staff working in my local hospital, but equally for staff working in social care. So and we know that home care workers collectively travel more than 4 million miles a day. So, this is a real crisis, I think. And I think that there's also, evidence of lots of anxiety from staff. So I think that we need some recognition of that, actually, and some investment and money in recovery and in addressing what the impact of that is. So we know that the NHS, for example, announced 1.5 billion additional money for inflation for NHS trusts, and how as social care, I think we need, as I say, we need parity for steam, and we need that to be addressed in terms of funding in the same way.
Thank you. Thanks, Sarah. ICSs, I'll come on to those now, they come onto a statutory footing in a couple of weeks, 1st of July. What difference do you think that will make to population health and how people work together in systems?
Well, I think we've seen many different changes in the NHS over the years, haven't we? So I think it's a legitimate question to ask, what difference is this one going to make? Having said that, I do think there are opportunities, and in terms of impacting on population health and improving health outcomes and outcomes for people, I suppose the opportunity really is about how we work together and use our collective resources in a way that really does focus on tackling inequalities and inequity in a way that we've seen that really highlighted through the pandemic. If we just keep using our resources in the same way, we're not actually going to do anything differently to tackle that. So I think there is an opportunity there. If we think about our resources collectively, then one would hope we can do a better job than has been done. And the opportunity, I think, for people is to make sure that care is really joined up around them, and people get a seamless experience. So I think there's an opportunity to improve the experience of care as well. But essentially, ICSs are about partnerships, aren't they, and about drawing every part of the system together. So I think it's really critical that they do fully involve colleagues in adult social care, and that we have a strong voice around that table, because I think I think there's a risk that the kind of governance and those sorts of discussions overtake what's really important in terms of what can we do together to make those improvements that you referred to. And I think that's about shifting the system to think much more about prevention in its broadest sense, and early help, and thinking about those community services. And as I say, I think there's an opportunity to build alliances with community services, mental health, primary care and social care to really improve that offer and help for people in their own homes. So something about how we work together to break that vicious cycle of focusing on the crisis end of the system, or focusing on discharge, rather than actually helping people to stay independent, stay at home, stay healthy for as long as possible, and prevent those crises. So I think those links with wider local authority services, so for anyone in adult social care, that partnership with housing is as important as with health. So making sure that ICSs are working with ADASS and with local authorities more broadly to really bring to bear that wider set of assets on solutions for people. And I think clearly ICSs will have they will be different in different parts of the country in terms of how they've been configured and how that works with local authorities. But I think that the importance of place, and indeed neighbourhoods within all of that, is really important. So being able to make decisions as close to people and communities as possible, and try to create more a sort of bottom-up approach than we've used to seeing in the way the NHS operates. So that's a huge challenge, but I think also an opportunity if we can begin to make some of that happen.
Yeah, I agree. I mean, it is a huge challenge, and it's very different. It's very different to start looking at prevention and avoiding frailty and keeping people well and keeping people out of hospital, keeping people living independently at home, as opposed to a model of reacting and managing situations when they're in crisis. So it is a great opportunity. And I think the other thing is just to make sure that the social care voice is really heard within that partnership.
I think it has to be heard loud and clear, really, if we're going to, if the ICSs are going to deliver anything different.
So you mentioned earlier, think local, act personal, and that's very much about people's voices. So how do you think, in terms of the conversation around co-production, that we can make a reality of that and listen to people and develop and build, create new care models that actually meet the needs of people as they see them?
Well, I think our role is to create the conditions for that social innovation, and people and communities often are the best people to know what those solutions are and how to innovate. So I think it's really fundamental to the way that we work. And I think that's, as a social worker, that starts with how you work together with an individual to help them to, realise their ambitions and what they want to do with their lives. Rather than coming as a professional and sort of doing to people. So I think that working with people at an individual level, but also working with at that more strategic level, working with people who draw on care and support, working very closely with our communities to design services and to help to make those shifts in effect. And I think there's lots of good experience, if you like, that's perhaps come out as lessons from the pandemic, where if you take something like the vaccine programme, it was a sort of nationally led, rolled out programme. But for the sort of 20% of people who weren't going to respond to that programme, the work, for example, that we did in Greenwich, and I know colleagues did in lots of other authorities, was really co-producing with people how are we going to enable access for everybody for this, and that was very successful in terms of tackling some of the inequity and inequalities. So I think it's I think it's fundamental. I think we've got the Care Act, we've got which is a really good piece of legislation. I think what we need is to see that fully implemented and fully funded. And to see that implemented in local places, communities, in local authorities, we have to do that working, I think, with people and through that co-production.
Thank you. So, my final question: if you had a magic wand, what 3 wishes would you grant for social care?
Well, can I only have 3? I think firstly, I would say that parity of esteem, that social care is not seen as an afterthought, which I think was very much our experience in the early days of COVID. So and that means social care being seen as an important part of really vital work in terms of supporting people to live their lives and to do the things that they want to do. And being a parity in terms of that being that voice around the table to achieve that. And I think that that's the only way we're going to get out of this sort of vicious cycle that I referred to, where if we don't address needs early, then things just deteriorate, and then people. So, for example, people at the moment who aren't able to get the support they need in the community because we can't source enough home care, their needs will deteriorate. Their carers, their carers are likely to become less well, etc. And then we see more and more pressure on health services. So I think my first one is parity. I think we've talked quite a lot about workforce, haven't we? So I think the second one definitely has to be around a workforce strategy, but as part of that, really addressing those issues around pay, how we value social care workers, and those how the skills are valued, as you say. People do really brilliant, very highly skilled work in social care. So having that recognised and valued, and then reflected in pay and the sorts of ways that we structure our services as well, that begin to address those terms and conditions issues. And then I think my third one would be to broaden that understanding of the breadth of social care and the contribution it makes to supporting people in their communities. So, I think we've had there's definitely more of a national conversation about social care. Often that's still dominated by thinking about care homes, where people can sort of see physically, have an image of what social care is. But social care is so much broader than that, not just in terms of home care, but that highly skilled work, working with people in their communities, helping people, from helping people into paid work to supporting carers so that they don't reach that kind of breaking point, to helping older people stay healthy and well and independent for longer. So huge breadth of work. I haven't even touched on homelessness and neglect and abuse, but actually it's a huge breadth of work, which is really important and valuable. So I think raising people's awareness and understanding of the whole breadth of what we do, and then shifting those resources to, once you understand the breadth of that work, I think people can then see the value of and importance of shifting the investment and some of their resources into that preventive and more community-based support and in social care.
Thank you so much. Sarah, thank you. That's the end of our podcast chat. Thank you so much for your time today. It's been really valuable, and we're in really interesting times, and we'll see what happens over the next 12 months, and hopefully we'll see a real difference in the kind of care that people are drawing on. Thank you so much.
Thank you, Karen, and I hope so too.
Our next guest will be announced very soon, so keep an eye on our social media. A reminder that the link to nominate for the Social Care Top 30 is in the podcast description.